Um, it gives me immense pleasure to introduce to you our speaker for the day, Ms. Harleen Walia, who is the Deputy Director of Childline India Foundation, which anchors the 1098 helpline with a demonstrated history of working in the development and non-profit organization management industry. Ms. Walia is skilled in policy analysis, capacity building, donor management, government relations, and civil society engagement. She's a strong community and social service professional with an academic background in political science and professional training and experience in mental health counseling and policy advocacy. Her experiences include uh, UNICEF supported senior consultant for child protection in the Ministry of Women and Child Development, training and development specialist in the UN office, drugs and crime, gender program officer in the Center for World Solidarity, as psychosocial rehabilitation program coordinator at Sanlap India, where she started her journey in the field of child protection. Also as a Montessori teacher at Young Learners School, Kolkata, where she started with the founder. We welcome you, ma'am, to today's session, and indeed a great privilege to have you here amongst us. I now welcome our principal, Dr. Swati Pal, to this session today. Thank you, Dr. Pal, for taking time out despite your busy schedule and being with us here today. And on behalf of the HDFE department, thank you so much for facilitating this entire session for us. I request you to now welcome our speaker for today, Ms. Harleen Walia. Thank you, Dr. Pal.
Thank you, Nimi. Ms. Walia, faculty members of this college and other colleges across the city, and of course, beloved students and friends. Today is quite a landmark day for me because it is indeed a pleasure and a privilege for me to have on board somebody I've known since a time that I can't even put a date to anymore. It seems like forever. And I do want to share something about Ms. Walia, which is beyond the biodata. It's a very impressive biodata indeed. And as you know, she is the right person, not only to be Deputy Director for Childline, but to speak to us about an issue which is so close to our hearts. What I want to say is that Ms. Walia and I belong to a generation that was fired by a lot of idealism. And I'm very happy to state that in the years that she has evolved and matured into this hi-fi professional, that idealism still remains, that fire still remains, that passion still remains. And in a world where everything is coming apart, I think it's wonderful to have somebody like her to be speaking to us. As far as the topic is concerned, children in distress, बच्चे जो इस कॉलेज के हैं और बाकी कॉलेजेस के भी अब तक तो जान ही गए होंगे कि ये मुद्दा मेरे लिए बहुत ही अहम है। अहम इसलिए है क्योंकि बहुत सारी ऐसी आवाजें हैं जो हम सुन नहीं पाते हैं। There are many voices we cannot hear. And when I say that there are many voices we cannot hear, I don't just mean human voices. I also mean the voices of animals that we cannot hear. I also mean so many other voices that get suppressed apart from those of children. And so it is so important for us as human beings to reach out, to do all that we can to help people in distress, to help animals in distress, to help minority communities in distress, to help marginalized people in distress. Children, of course, are very, very dear to all of us. And it sometimes troubles me, the fact that, Harleen, and I'm putting this question to you, the fact is that yes, we have a helpline for children in distress, but I'm wondering, what about those 2-month-old and 3-month-old and 4-month-old children who are sometimes sexually exploited? How do they reach out? How do they call out to anybody when they are in distress? And there's just nothing, that there's no helpline really for them, you know. The only helpline that exists is in our own heads. The only helpline that exists is a time when perhaps people will stop being so, I mean, I don't have a word for it. I can't even say stop being like wild animals, because animals don't behave the way human beings often do. So my heart really goes out to those children, and I'm really waiting. I still live in hope that there perhaps will be a time when those children will not have to, there should be no requirement really for a Childline for us in human society. So with these words, I, on behalf of everyone at JDMC, have great pleasure in welcoming you, Ms. Walia, to this platform. Thank you for being with us.
Thank you, Dr. Pal, for your kind words. I now request Ms. Harleen Walia to initiate the session for today. Welcome to the session, ma'am.
Thank you so much, Nirmala ji. And now I'll ask the most oft-asked question in the recent months, which is, am I audible?
Yes,
Can
please.
you hear me?
You are.
Okay.
Yes, please.
So in case I'm not, I'd expect Prerna, who I can see on screen, to raise her hand and say, "Nahi sun pa rahe," you know, make some gesture towards your ears or something, and I'll try and adjust my mic. I will also be trying to share my screen so that, you know, you can have a glimpse of all the things that I'll be talking about. And in case there's a slight delay in that, please bear with me. Before we start, at the outset, yes, indeed, it is a privilege to be speaking at Janki Devi Memorial College. Considering that the principal of the college is, as she said herself, someone I've known forever. It is indeed a privilege to be hosted by a college which I have seen change in the last 12 years that I'm living and working in Delhi, and go, you know, from a college of one kind to a college of a completely different kind. And I'm sure there are many, many more milestones that this institution is going to reach in the near future. I'm also here to talk about an organization which I not only work for and with, but an organization which actually symbolizes hope for me as a child protection practitioner. Not just because of the work it does, but because of the fact that it's a vision. It's a vision that was given fruit, given birth to through one of us, someone like us, a human being. And that's a huge source of hope. So I will answer Swati's question, the concern that she raised, which she also answered in a way towards the end of my presentation. But to start with, I would like to start with that small ray of hope, which we call Childline, thus no art, 1098. Yeah, I'll just try and share my screen now, and I hope I'm successful. So otherwise, I'll be asking one of you all to. Can you see the screen?
Yes, please.
Okay, superb. So far, so good. Perfect. So I'm trying to go to the PPT mode, which will take a little while, it seems. All right. So while Childline 1098 comes onto screen, I will be talking a little bit. I was given to understand that the participants in today's workshop have gone through a session on abuse. Have already gone through a session on abuse, and they are now familiar with various kinds of abuse, and also they are familiar with the various methods that are available for these forms of abuse. I would request Nirmala ji, is it possible for us not to get these notifications in the middle, and can
I think these
seeing
are people who are entering now. I
trying
think
to
that is
enter?
why. Yeah, it's
Oh,
very
okay.
distracting. I understand. I
Yeah,
know.
because I keep thinking I have done something wrong, and
No, no.
suddenly
The,
this
your
is
presentation
Your
is visible.
co-host, it's going to appear on your screen also. Just ignore it.
Yeah.
okay. Fine. So yes, starting with Childline. So so as I was saying, I was given to understand that you've already gone through a session on abuse, uh, and what I will be talking to everybody about is how 1098 views abuse, what is Childline 1098, what is the model, what are the kinds of interventions provided, what is the system that works, what happens when a call lands on 1098, what is the kind of help that's provided thereafter, and also I want to focus a little bit on the last few months, which have turned all our worlds upside down with the pandemic, COVID-19, and how it has impacted Childline, and how Childline has, from being a field organization with a huge face-to-face role to play with children, has not only done just that, but has also risen to the occasion and done much, much more. So I'd like to focus a little bit on that as well as we move along. As I said, the model, the scale, the coverage, and Childline versus, we call it versus. We think, so I'll be speaking in English and a little bit of Hindi. And I hope everybody in the audience will understand both languages. And बाकी हम COVID-19 को युद्ध की तरह देखते हैं, हेल्थ डिजास्टर है और डिजास्टर ही है। जिस तरह बहुत सारे डिजास्टर्स हम चाइल्ड लाइन को डील करने पड़ते हैं या फेस करने पड़ते हैं, फ्लड्स हो, महामारी, ये एक ऐसा डिजास्टर है जिसमें the twist here is that none of us have really experienced something like this in our lifetime. So there is no model to really look for, to learn from. And it is in this context that Childline has been functioning since March 2020. So, what is Childline? A few stories, a few little bit of almost like folklore. So yes, it is India's first and only 24-hour free emergency phone outreach service. The difference, there are child helplines across the world. This model has been emulated in 143 countries across the world. The difference between the Indian model, so it's very much something which has been born in India and actually inspired the same model across the world. The difference between the model of the helpline here and elsewhere is that Childline is not just a telephone service. Childline is a tele-outreach service. Not only do we receive calls for help, but we also have local teams, local units in various districts in the country to reach out physically to a child who needs our assistance thereby. So it has both these combinations of telephone assistance as well as outreach. It is, we are given to understand, it is the largest child protection network in any one country. And it is a model of partnership at various levels. It's category 1, so therefore it becomes mandatory for all service providers to connect, to open up to 1098. So on mobile, you can actually connect to 1098 through all services. On landlines, it would be through BSNL and MTNL. As I mentioned before, Childline is a partnership at various levels. So this is very key to understand if you want to understand the spirit that makes Childline buzz the way that it does. So it's a partnership with government. It's a public-private partnership with Government of India, with Ministry of Women and Child Development, without whose support the scale that Childline has reached would not have been possible. It's been 20 years of a partnership. And the organization that I work with, Childline India Foundation, was actually created to anchor and spread these services, make available these services across the country. So it's a public-private partnership with MWCD. So in the other models across the world, you have a lot of partnership with government, which is based on a lot of moral support, endorsement, and so on. But in according to our information, this is probably the only partnership on child protection in the world for helplines where the government is a co-implementer, so to speak. It's part of Childline India Foundation structure, and it also provides the financial support for the services on the ground. It is a social franchise model. As I mentioned, it's not just a telephone helpline. It's a helpline where you have local NGOs, local units who are Childline partners, reach out to the child for assistance. And we have over 1,100 partners as on date, 1,100 units of Childline across the country. It is a partnership for technology, state-of-the-art technology, and with Tata Consultancy Services, which, as you well know, is one of the best technology companies in the country and also in the world. So TCS has not only designed the software on which our calls are recorded and our calls are received, our Childline contact centers, where your call lands, in the country, are situated in the TCS services, in the TCS complexes. So though they provide the infrastructure, they have helped us with the software, the personnel, the people who are receiving the calls are social service or social work background persons who are recruited by Childline India Foundation. Most importantly, and this is something I would really like to stress upon, friends, because this is a part of the culture and the spine of Childline since it started, and the reason for it. This is a service which has the child at the center of everything. And it began so many years ago in 1996 as a project of TIS. It began in Mumbai through a workshop where street children living on the street, in contact with the street, told the founder, Jeru Bilumoria, who was an assistant professor, and went on to launch various helplines across the world. Jeru Bilumoria was told by those kids, and you know how children on the street are very resilient, very smart. They said everything else is okay. But you know, if we had someone who we could talk to, someone who could just pick up the phone and say, hello, Didi, मुझे ये प्रॉब्लम है, मुझे ये तकलीफ है, कुछ बताइए, कुछ कीजिए. If we had that, we'd be happy. And that's how the idea of Childline was born. The number itself, 1098, and I'm stressing on reading it out or saying it in a particular manner because it has a story behind it. The number itself was given by those children who said, ulti ginti, 10, 9, 8, easy, आसान होता है याद रखना. Keep the number something like that, 10, 9, 8, 10, 9, 8. So the child is at the center of everything that Childline does. And an example of that is that till today, in every Childline district, you have mandatorily activities with children, which we call open houses, whereby children are asked for their feedback regarding the service and how it has helped them and how it can be made better. So that is what Childline works with. Very briefly, our mission and vision, any service, dear friends in the audience, is fueled by a vision, and this vision was definitely Jeru Bilumoria's. It has been strengthened, it has been built, and it has been sustained by committed Childliners through these, this is the 25th year started, through these years of functioning. You have people who have been with Childlines for 2 decades now, and they still remain because they feel there's no other place they'd rather be. And I think it is people like that who build institutions. We have an example in the principal of this college as well, and I would like to think that it's human beings, if an idea can be great only as long as it is translated into action by human beings who are committed to that vision and idea. And I think Childline has been very lucky in getting teams like that who've supported it. So the vision of Childline is that that this country, this nation, and thereby this world, because we are, such a large part of the demography of the world in terms of population. So this country will be a child-friendly nation, which will guarantee the rights. Please, I'm laying a lot of emphasis on the words guarantee of rights, because that links to whatever we are going to be talking about today. And our mission, of course, was that we're going to do it. How? We're going to do it through these, what we call the 4 C's, which is we're going to connect with every child. Every single child matters. So for us, if we look at the large picture of so many children who are affected by abuse and exploitation, and then look at the numbers who we can reach out to, it should make us feel despondent. It should make us feel, are itna hi. But that's not how Childline thinks. Childline thinks that when we started in 1996, it was one small unit. It was one workshop. It was one group of children telling us, 10 9 8 shuru kijiye. Yeah, 10 9 8 has to start. It was that vision, that idea, which is now translated into a national child protection service, which covers 83% of this country. So we firmly believe that every single child who we've reached out to has mattered and has contributed to what Childline is today. We believe in being catalysts. Childline, if you look around, you will see a lot of organizations, you will see a lot of initiatives, very good initiatives at that, who are in social media, in media, who are globally known, who have a lot of bandwidth in terms of awareness and campaign. Childline has always believed in being more of a catalyst. So we believe in making the system work. So we have district officials, and we work very closely with governments at state level and at district level, जो कि हमसे कहते हैं कि sometimes there's nothing available for a child in that district, and then suddenly वो Childline वाले आ जाते हैं, बच्चे को लेके सामने खड़े हो जाते हैं, तो system को respond करना ही पड़ता है. So we believe in being those catalysts. To be those catalysts and to reach every child, we believe in collaborating with all kinds of stakeholders. And we also firmly believe, that child protection should be everybody's business. It's not the business of police. It's not the business of the family only. It's not the business of schools. It's not just the business of community alone or an NGO or even the child. Child protection is everybody's business. And unless we look at it in that way, it will be very difficult to keep those children who Swati was referring to earlier in this session, to keep them safe. It's only when we make it our business that we can succeed in doing that. This is the kind of background and context that we work in, and we are very aware of the challenges that are there socially, economically, politically, and all of that to keep children protected. We focus on the child. That is our aim. In the last year, just to give you a kind of a comparative, in 1920, we did receive calls for a category of calls which we call child protection concerns, protection from abuse cases. So we received more than 1,29,000 calls last year. I'll be giving you more information regarding the kind of calls that we have been receiving in the last months since the pandemic began in a little while, but this is how we were last year. These are the kind of, these are Childline children. These are the kind of cases that we see. These are the kind of, people who we have to respond to on call. So it's not just calls from children, it's calls from adults as well. And Childline reaches out to all these callers wherever required, wherever physical intervention is required. So it can be runaway children, it can be child marriage, it can be sexual abuse. I'd like to just stress on one thing in this, that for a lot of people, they are not aware that Childline is not just a response mechanism. It doesn't just respond to a case after the abuse and exploitation has happened. Childline is also a preventive mechanism. It responds to situations where, if the child is not helped at that point of time, the vulnerability to abuse and exploitation, which will be huge. So say, for instance, a child who has dropped out of school, or a child who does not have the fees to go back to school, or a child who is suffering from malnutrition. All these various situations, a child who's lost, a family which has lost their livelihood or their home due to a fire. So we get calls of various sorts. We get calls from families asking for help to get documents for children, so that they can avail of government services and schemes. And we, as Childline units on the ground, help in all those situations. So this is something which not many people are aware of. So one of the first questions we are asked is, कितने abuse के cases हुए, कितने exploitation के cases, कितने trafficking के cases हुए? वो तो होते हैं. Yes, of course, those are a very important category. But so also are missing children. So also are situations where children are looking for some kind of entitlements. So this is what I was trying to stress on, that Childline views any violation of rights as abuse. Any violation of rights as abuse. And this is something that we place a lot of emphasis on. When I say violation of rights, and I assume that you all have already been introduced to what child rights are. So if we look at the 4 different broad categories of rights, which would be right to survival, development, protection, and participation, the broad categories, then any violation of these rights which can result in a child's dignity, a child's well-being being affected, Childline deals with that. I'm sorry, you'll just have to excuse me for 1 minute. I'll just reach out to my bottle for water. Just give me a second, please. Sorry. So as I was saying, so violation of any of those categories of rights we count as abuse, which is why you will find Childline working to get children their papers, working to get children into school, working to get children emergency nutritional help, as in taking them to the hospital, working to help an accident victim. So you will find them in all those cases, and not just in cases of abuse and exploitation. How does it work? So you have a system where you have the reaching out to the child in the district, right in the center, through the local Childline unit. And on one side, you have the Childline contact centers where the 1098 calls land. These are in 5 locations across the country, in Chennai, in Bengaluru, in Kolkata, in Mumbai, and in Delhi and Gurgaon. And these cover the respective zone where they are situated. We have another contact center in Bangalore in the south, apart from the Chennai one, because the awareness about abuse and exploitation in the south is extremely high, and Karnataka was very proactive in reporting cases of abuse and exploitation. So it was felt that a separate contact center, a smaller version, would be required there. And that is why it exists. So you have the Childline contact center where the calls land, where you have call management, data management, analysis, and all of that. You have interventions happening in the district, which is right in the center, through local civil society organization, NGOs, and as I mentioned earlier, over 1100 of them. You have a program team in 4 regional resource centers, again in Mumbai, Kolkata, in Delhi, and in Chennai, which handhold the local Childline units, which train them, build their capacities, and also look at telecom issues, connectivity issues locally with the partners. So between the call response and the hand-holding unit is your local Childline unit. And this kind of completes the whole circle, just as Government of India is a co-implementer with Childline India Foundation for Childline Services. Childline India Foundation, in turn, in the social franchise model, is a co-implementer with the local Childline unit. This is how it looks. It's part of a scheme called the Child Protection Services Scheme. And in every district, you have one main organization called the collaborative organization, main as in the main case response organization. And apart from that, you also have, resource organizations. You have a nodal. Nodal is normally an academic institution. So you would have a school of social work, or you would have, say, for instance, NIPSID, organizations such as this, who are nodals in the district and who help in training and advocacy at district level. To ensure coverage, the Child Protection Services Scheme, so Childline is funded, is supported by government under a particular scheme, the Child Protection Services Scheme. It was earlier called the Integrated Child Protection Services Scheme. So now, under the Child Protection Services Scheme, you also, to ensure coverage, you also have a provision for sub-centers. So not only do you have a main organization at the district headquarters level, you also have right at block level in charge of 2 or 3 blocks under one sub-center. This model has not completely been put in place. Expansion is still going on. However, once these structures are in place, we can, again, to refer to Swati's concern earlier, we can reach out to many more children and ensure that they are protected, because the coverage will be more deep in every location. Interesting thing for the Childline model, which I'm not sure which you noticed in the earlier slide, is that the Childline model is headed by the DC or the DM at district level. They head the Childline Advisory Board, which is supposed to meet twice a year at least, and to speak specifically on issues related to the service. So now that brings you to call response. So going by the slide that I showed you, so the first aspect is calls landing at 1098. All right, and this is at a Childline contact center, as I mentioned, in 5 locations within the TCS complexes. So with this software and infrastructure coming from TCS, and the persons, the personnel picking up the phone and answering and saying, "Hello, Childline," are Childliners recruited by Childline India Foundation. So what is so special about this facility? Well, it's probably the first time, and it was so many years ago when it began. We had our first Childline contact center way back in 2012. That technology was used to make child protection possible. This is one of the interesting things, right from the phone service to the use of other complicated forms of, evolved forms of technology. Childline has always pioneered these aspects for child protection. So you have a 24/7 facility. You have people working in shifts. You have about 343 people working in shifts across these 5 locations. You have calls being answered in 3 to 5 seconds. They are supposed to pick up on within 3 to 5 seconds. You also have every call being recorded, you have scripts for all kinds of calls. So for instance, if Childline is providing or is supposed to provide information on Swachh Bharat Abhiyan, then there would be a script which would roll down when a call for information regarding Swachh Bharat Abhiyan lands at the Childline desk. So yes, all calls are not for help to children. There's a huge volume of calls for information, not just regarding child protection, but regarding services available for children. Yeah. So all these aspects, how long it has taken to deal with a call, how long it has taken for the call to be answered, how long has the person spoken, all these aspects are monitored and are recorded and tracked for quality assurance purposes. This is how the intervention flows. Someone called Trupti has raised her hand, so I'm not sure what that means, but I presume she has something to say. Trupti, I'd request you to please wait till I finish. Please make a note of your question and I'll try and answer everything at the end of this presentation. So after the call lands, as I said, there are all kinds of calls. After the call lands, if it is a call which requires a Childline unit at the district level to reach out to the child, the call is transferred to the local partner. If the call requires emotional support and guidance on the telephone, or if the call is a prank call or an abusive call, or if the call is a call for some kind of referral service, or another category of calls is a silent call, where we can hear background sound, but nobody speaks. And very often we have seen silent calls, which we call confidence building calls. Silent calls often translate into a child coming onto the phone. All right. So we take every call that comes from children, even if it's a prank call and they are laughing, we consider it an achievement, because we feel if they've called once, then when they need us, they'll definitely call again. So if the call is a call which can be handled on the phone, that happens. If not, then, and it requires an intervention, the call is transferred to the local intervention unit. I'm specially explaining this because you will see that at any given point of time, Childline has X number of calls being answered. But you will also see that at that same point of time, the number of physical interventions are Y. So the question can come to your mind that, there's a difference between X and Y. Yes, the difference between X and Y, and that is with every helpline across the world, is that you have a volume, a certain number of calls, which are purely related to information, which are purely related to emotional support and guidance on the phone. And also you have a certain amount of calls which are completely irrelevant. They are abusive at times. Trolling on the phone is something which Childline has experienced for many years now. So we have prank calls, abusive calls, and also you have calls for information and referral. These are the ones which are not handed over. If the call is handed over, you have an elaborate juvenile justice system. There are various kinds of needs that the child has. If the need is for a document, if the need is for helping the child to get back into school, then there is no requirement for the child to be produced before the Child Welfare Committee. Childline helps the family, helps the child for all those reasons. If the requirement is immediate emergency nutrition, even in those cases, the child is not brought into the juvenile justice system. But if the matter is regarding any of the issues which would qualify that child to be a child in need of care and protection, then that child is brought before the juvenile justice, brought into the juvenile justice system in front of Child Welfare Committee. What is a CNCP? A child in need of care, very well defined in the JJ Act. So from children who've run away, to children who've been abused, to children who've been abandoned, to children who've been forced into marriage, who've been trafficked, who are drug dependent. There are various categories. There's a long list in the JJ Act, and any of you who are interested can check that up in the definition section. Yeah. So if a child is a child in need of care and protection, they're brought before CWC. This is what we do. So the question we were asked was, what does Childline do? So apart from providing information on the phone, apart from providing emotional support and guidance on the phone, Childline also rushes to the child, provides emergency help based on the Child Welfare Committee's directions for a child who is CNCP and produced before the committee. The child is referred to for restoration and rehabilitation. So there can be various directions that the CWC can give. The CWC can say, take the child to the shelter home. The CWC can say, do a home study to find out, where the child is, what is the circumstance that the child has been brought here from. The CWC can ask for a home study or a check in a situation in another state, in another district, where the Childline network comes into play and works to find out the details. So that can be a case. Then in all these, CWC can ask for medical, can ask for some other examination. So these things, whatever directions are given by the Child Welfare Committee and to Childline specifically, these directions can be given to various authorities, but very often they are given to Childline. Childline helps. So the task is for a CNCP child is to bring a child from a situation where they were either unsafe or had the potential of being unsafe to safe custody. That is the basic aim. This I've already mentioned to you earlier, but one thing that I'd like to stress upon also is that not only is a Childline unit or a Childline India Foundation program team, not only are they looking into case response, not only is the CCC answering calls related to child protection, but Childline units on the ground are also doing continuous outreach. As I mentioned right at the outset, it's not just a telephone service, it's an outreach service. So not only are they doing outreach when they're responding to a case, they're also doing outreach into vulnerable communities and thereby identifying children who need assistance even before they fall into a situation of abuse and exploitation. So those are a large volume of our cases, a large number of cases, almost 40% come through outreach services. This is a snapshot, and very quickly if you look at it, in the last 6 years, Childline has grown from 279 districts where the service was available on the ground for children to 594 districts now. We cover over 83% of the country and almost 1100 units if you combine the railway child lines and your district child lines. In last year, we had answered 72 lakh calls. And of those 72 lakh calls, about 3.5 lakh calls were related to direct interventions, interventions where the teams had to reach out physically to the child. And then there were what we call indirect interventions, which I've mentioned, which include emotional support and guidance, providing information about services, and so on. The 1.75 lakh that you see on your screen in terms of interventions is the number related to the COVID period from 20th March onwards to 31st August this year. This is the number of interventions that Childline has undertaken in this period. We also, apart from covering districts, a very interesting program that has been started by Childline, and I think that will answer, many of you may have the question that what about vulnerable spots like bus stations, railway stations, and so on. So it's an institutional mechanism where Ministry of Railways and Ministry of Women and Child Development have got together to establish child help desks in railway stations. That is run by Childline. So it is currently available in 132 railway stations. And if you move through, or next time any of you plan to take a train for somewhere, please do check out if there's a Childline child help desk in that station. Delhi does have it. So please do check it out on your way out to see how they are working, what they are doing, and so on. So you have these child help desks in 132 railway stations. And the figure related to COVID, I've already spoken of before. This is where we are, 594 as I've said. This is our coverage. I spoke about children being at the heart of Childline. So children being at the heart of Childline, in effect, means that we have these regular activities which I call open house. So in 1920, we had over nearly 8,000 open house sessions with children, and every session is supposed to have about 25 to 30 children. So we had open house children, and through our awareness activities as well as through open houses, we have interacted last year with over 5 lakh children directly, as in face to face, yeah, asking them their opinion, asking them their needs, and then not just stopping at that, but organizing interfaces between government, district administration, and children. So if it's in a school, then we probably bring in somebody from Department of Education to talk to the children about some, grievance that they may have regarding facilities in their schools or their teachers not coming for classes and so on. So this is the kind of content that the open house propagates, and that's there for you. So not only, as I said, do the teams do outreach to identify vulnerable children, they also do a lot of advocacy at district level. We do a lot of advocacy at state and national level, so that those needs of children are translated into law and policy. So one example that I can give you is that Childline is a part of the Juvenile Justice Care and Protection of Children Act. It is a part, it is defined, the service is defined, and that is very much, been a result of the advocacy done by Childline. For some reason, it's not moving. I'm sorry, it seems to have got hung for some reason. So I'll just try to escape. There you are. So, yes. So apart from advocacy, what you're looking at, and this is self-explanatory, is we run a campaign called Childline Se Dosti. Those who live in Delhi, I don't know if you've seen this, but on railway stations, in various areas like CP and all, you'll have kids putting up stalls. You'll have kids, with Childline Dosti bands. This is normally in November during the Child Protection Week, from 14th November onwards. And there are various activities conducted at the same time across the country, wherever there is a Childline. You also have events such as Hosla, which was a wonderful experience really for 3 years, which we were part of with the Ministry of Women and Child Development. It's their event, and we helped in co-hosting certain activities, and called Abhivyakti, which was self-expression through drama and music and debates and so on. All these children who you see are children who are living in childcare institutions. And the wristbands that you see are the kinds that they go around tying on police and on vendors and on people walking on the road during Childline Se Dosti Week. Some of the pictures here are of pictures during Hosla, where they were performing and expressing themselves. Bookaroo is a organization which promotes the reading of books and organizes various melas and fates. Childline partnered with Bookaroo. So the stall that you see here is a typical Childline stall, which happens at any of these events for awareness. One very interesting initiative that took place last year, and this is specifically with reference to abuse and exploitation. So if you ask us what do we do, yes, we respond. Yes, we do advocacy. Yes, we try and bring change in mindsets. One of those initiatives was with the Ministry of Education last year, where we participated in Nishtha. Nishtha was a training program for teachers initiated by Ministry of Education. And Childline was brought in as a resource person to train on rights, abuse, sexual abuse, and the legislation related to that, which is the protection of children from sexual offenses, POCSO. So we actually interacted with over 20,000 teachers in a span of 6 to 7 months last year. And this year, as of this month, we have the Ministry of Education has digitized that entire module, and Childline has contributed to that. So you have a digitized Nishtha module, which Childline is a part of, and it's available on YouTube in the in the NCERT and Nishtha portal. Also Swachhata, now the twist in Swachhata, and you'd ask Childline and Swachhata. So we use every opportunity to reach out to children and to communities to change mindsets that we can, whatever opportunity we are given. So under Swachhata, what we spoke about was the Swachhata Andar Bahar. Swachhata, cleanliness in thought, cleanliness in the heart, cleanliness in your speech, and then cleanliness in action. So we spoke about Swachhata Andar Bahar. That was our concept, and we felt it was very related to prevention of violence against children. And in that space, we organized almost 395 events, though there were 295 slotted, but Childline always uses its resources for more than what it can do. And we did that and reached out to over 57,000 children and 38,000 adults, officials and functionaries and teachers and so on, through the Swachhata activities. I don't know how many of you has seen Komal, but I would strongly request all of you. It's a national award-winning film. It's created by Childline, and it's available on YouTube. If you've gone through sessions on abuse, especially child abuse, please do see Komal, because there are nuances in abuse which only a practitioner can tell you. And the nuances are very, though it's an animated film, and it's the protagonist is a young girl, but the nuances and the process of abuse that is described there, that is common to all age groups. So please do take a look at Komal whenever you get the opportunity. Again, yeah. For sexual abuse, especially, we've had in Bombay and in Bangalore, we've had this project with the help of Reliance Foundation, where we reached out to a number of schools and children through volunteers who've actually gone and conducted sessions using Komal as a backdrop, which has trained children or exposed children to information regarding safe and unsafe touch. Another thing I'd like to request is please refer to it as safe and unsafe touch, not as good and bad, because that is relative, and safe and unsafe, because it ends up a touch which is not safe ends up in putting the child into a situation which is abusive. So please use the terms safe and unsafe. COVID, as I said, I would just touch upon COVID and how we fought it. This is Childline. So we put this out when the pandemic started to announce that we were not locked down. We knew that there were children who could not access schools. We knew that there were children who would not be able to go out and meet their friends or access all those other resources through whom they could report. But we felt that it was very important to give the message that in case you want to, and in case you have to, whether you're
नमस्कार चाइल्डलाइन बात कीजिए
or you're a concerned adult, please report to us. We are there for you. Post lockdown, we have been we've seen in the first few days of lockdown, we've seen calls shooting up. We've seen on a daily basis, we've seen 300 to 500 calls being answered. Most of a large number of those calls were related to shelter, were related to food. As you well know, the pandemic unleashed a situation of distress migration. It unleashed a situation of pure panic, which carried on for quite some time. And when no other number, there were many situations where when no other number was reachable, they got through to 1098. So we have helped to the maximum of our abilities, and we wish we could have done more. Till today, we wish we could have done more. But after a particular period, say the first 2 months, from May, June, as things kind of not settled down, but I think we got more used to being in that situation. Calls have plateaued, and our interventions. So those calls were not just related for assistance; they were also for information. So now the calls are more related once again for interventions, for actual physical assistance on the ground. In this period from March end to now, Childline has has answered over 23 lakh calls. I'm repeating again, as I said earlier, every call is not a call to report abuse and exploitation. Please, I'm stressing on this because there's a tendency to, sensationalize and take these figures out of context. And I would not want that to happen at all, or for any of us to panic. So yes, things are not good as far as protection is concerned, but it's not, as bad as it's made out to be very often, because there are systems on the ground which are responding, and that's a huge source of hope for many of us. So you have these calls being answered. You have you have nearly 2 lakh interventions, 1.75 lakh interventions, and the average therefore of calls being answered is about 14,000 calls being answered every day, and you have about over 1,000 interventions with children being carried out every single day. Of these, what we've seen is that maximum number, 61% of these actually, have been related to COVID relief. So they've been from families, and it's been particularly difficult for Childline call responders, because we've had our teams tell us that, it's so painful to hear people saying, we don't have food, we need help, nobody's picking up the helpline, please, any other helpline, please help us. And teams have reached out with rations, teams have reached out with medical help, teams have reached out and also connected. So it's not that Childline is the only one working. That's not what we are saying. We are saying that they have worked with district administration to reach out and to connect people who are in crisis for services. What we've also seen is that from July onwards, June, July onwards, we've seen that the calls related to child protection concerns, to protection from abuse, have been steadily rising. So you've seen more calls related to child marriage, more calls related to child labor, more calls related to trafficking. Once lockdown slowly started opening up, and we started unlock 1, 2, 3, 4, whatever phases, and depending on the location where the child is, you've seen a steady rise and a spike in reporting of child protection concerns. So of the direct interventions that we've done, 20% only, and only is not to minimize it, but to stress on the fact, are related to protection from abuse. And that includes, it will include runaway children, it will include abandoned children, it will include children who are found begging, it will include physical abuse, it will also include labor, child marriage, and of course, sexual abuse. So it's all, this entire gamut is under what we call protection from abuse. As I said earlier, any violation of rights, Childline views as abuse. There we are, which is basically how it looks, whether it is sexual abuse cases that have been dealt with in these few months have been 8.6% of the number of cases that we've had. And you've had child labor actually, which is almost at par with that. But the maximum number of reporting has been related to child marriage. What else has Childline done in this period? We've had scripts. As I told you, every call is answered through a script. So we've created scripts on social distancing, on how to keep yourself safe from COVID, on hygiene practices, on the other helpline numbers and advisories. We have been providing mobility, transport, food, and kind of addressing the anxieties, not just of people who are calling, but also our own anxieties as teams who are reaching out to people in distress, to children in distress. We've had to address those as well. We've had to address situations where it's not possible to reach immediately So how do you deal with it using technology? How do you deal with it using the network? So these are all things that Childline has grappled with and coped with as it's moved along. We've created WhatsApp messages, we've created communication material which has been constantly, like the "We Are Not Locked Down" poster. There have been many such posters created through this period. And we have also, done orientations on psychosocial first aid support for teams across the country, for all our network, and on what are the strategies that we can have post-lockdown on helping children better. Uh, Over and above that, we've started a pilot in Delhi, which is now going to be extended with the help of NIMHANS and other agencies. We started a pilot with CSJ in Delhi, which specifically focuses on self-care and also providing counseling support for children. So self-care for caregivers, for those who are helping children, support groups for them, and counseling support for children who are affected by abuse. So we've done that as well. This is something that gives me a lot of hope. So Childline has always believed that we are an emergency outreach service. If we are an emergency outreach service, then it's our job to reach out to all children who are in distress. If that be the case, then in a situation where the entire country and so many people, so many families, so many children were reeling under the impact of lockdown and COVID, it was our job, we felt, to reach out to them with emergency help. And Childline has been helping with food, with PPE material, it's been linking communities, it's been distributing rations, it's been working with state governments, like West Bengal has declared it an essential service way back, right in the beginning. It has been doing outreach in tribal areas. So there are a number of activities ranging under awareness related to COVID and other help available. There have been innovations where we've started online classes for children in CCIs, learning activities. There have been activities where we worked in coordination, like in Uttar Pradesh, with the district and state administration, using a multi-stakeholder approach to actually help communities to deal with cases. And of course, there has been case management as always. So provisions to register a case on websites have been created. You have a resource corner. Please do take note of these and do visit whenever you get the time. E-letters have been created, which are also available on our website, and campaigns have been launched. We have done all this to address and to prevent abuse. In a situation where people were scared of stepping out of their houses, Childline teams were reaching out to every child who needed help. This is the reason why even an online form was created, so that in case you see a child, you can report. We have constantly been saying, however, that just like any other person, just like any other organization, Childline is also doing all this with reduced human resources. We have teams who are falling ill, we have families who are anxious. So these are all things which we've coped with during this period. Some of the material that has been created, some of the stories that that Childline is full of at all times, and more so at these times, which generates a lot of hope, from rescuing a baby who's been abandoned, to stopping a child marriage, to ensuring that trafficking of children, huge number of children from Rajasthan to Bihar, has been stopped not just by one child line, but all child lines along that railway route. So they worked as a network to do it. This is the message that we have been constantly trying to give our teams, because the realization that it is that individual who will do their job to the best of their ability, who will finally make a difference to that child's life, that realization has never been more strong than now. So we've tried to put a lot of emphasis, and we'll continue to do that throughout the year, on capacity building, of our teens and on encouraging them to do their best. Thank you. Now, I would expect that there'll be questions if everybody is not run away and if you're interested in knowing more. And
Thank you, Harleen, for that very, very insightful talk. We got so much information. You know, we had been reading about it, about Childline, but we didn't know how it actually worked, how it supported the children, and particularly the history that you went into, and how it came about, and how the children suggested about the Ulti Ginti. It's really fascinating. And I'm sure there are many people in the audience who are waiting to ask questions. Please address your questions to the speaker.
May I, Nimi, while people are putting their thoughts together,
Please.
open the account, please? First and foremost, Harleen, thank you so much. As Nimi said, it was absolutely fascinating. I, of course, have been hearing about it from you, literally from the horse's mouth from time to time. But I had a question to ask, which is, can you tell us about any one particular case that you worked on which did not satisfy you, in the sense that you're not happy with the outcome, if you're allowed to share it, of course, on this platform? But if there's one particular thing that bothers you, which is which you feel we need to all collectively work upon, perhaps.
so, as you know me for a long time and forever, as you say, it takes a lot for me to be really happy with something that we've worked upon. And my teams are quite fed up with their deputy director, who's constantly saying, "Aur kuch nahi kar sakte the, aur kuch nahi kar sakte the." So they kind of put up their hands and say, "Nahi, ma'am, aur kuch nahi kar sakte the." So I think I would rather, instead of talking about one case, I would prefer to talk about one issue, which is child marriage. I think that this is an area which requires a lot of work on all our part, because it's an area which is, it's an issue which is so entrenched in society. It has a law which punishes, it has a law which prevents, it has a law which nullifies child marriage. However, uh, child marriage or marriage in India is a huge event, and it takes place with the buy-in of families. So, punishing families, separating children from their families is not the solution. A solution probably would be for a lot of education, lot of awareness, for creating opportunities, and to go right down to, if I think of a deep dive, Swati, then it would actually mean going right down to addressing the gender issues which make marriage such a, you know, an event, or such a outcome for every girl's life, such a pressure on families that, you know, their daughters have to be married off by a particular age. So these are the kind of things, along with the economics of situation. So in many families, they feel they will not be able to, economics and protection, they will not be able to keep their child safe or their daughter safe if, you know, she remains in their house beyond a particular age. Many families would pull a daughter out of school, because the journey from her school, once she reaches 14 or 15, because the journey from her school, from her house to her school, is full of various unprotected spaces, and they are laborers or migrant families or whatever, and they don't have the wherewithal to ensure that protection. So child marriage is an issue which will actually require all of us as a society, as a community, and every single official to actually, you know, take cognizance and start working on it in tandem. Not one agency doing one thing and another doing another, but a comprehensive, integrated approach, starting with an awareness campaign. So I hope to see that fructifying, Swati. Otherwise, we will always have, you know, the huge numbers that we talk about, and we also have situations where, you'll have a team of Childline reaching, but it has to work with other stakeholders, with the child marriage prohibition officer. It has to work with police. It has to work with panchayats. So you'll have the team reaching, and then you'll also have situations where teams are being beaten up. You'll also have situations where teams are being threatened. You'll also have situations where others don't reach. So, this whole thing needs to be done in an integrated way. And that's why I think child marriage is an issue which we need to take cognizance of. 'Cause I'm not happy with whatever has been done on that ground.
Thanks. I think we could,
I would like to know if our students could volunteer in some way and help out, or do an internship or something like that with Child Helpline.
Oh, absolutely. If not with Childline India Foundation, I mean, not the whole lot together, then definitely we do have a lot of interns coming in. We have a lot of people from schools and colleges, especially during their +2 breaks after 10 and after 12. We have a lot of young people coming in and contributing. What we try and do is to involve them in the day-to-day work of Childline, which is to go out with the team, to go out for rescues, to sit in a railway station, to actually see how a protection team works, which we think is the kind of exposure, at least the students who come to us, we think that's the kind of exposure they'll probably never get in their life.
True.
So we want them to know that there are kids who live those lives as well in the same way as you live your life, and not that makes these children any less vulnerable to abuse and exploitation. That is the children who come to us. We are not saying that for one, but we want that exchange between various kinds of children so that their lives are richer because of that experience. And so we do that. We do have that system, but it's not a paid internship. Like there are number of institutions which provide stipends and so on. So we don't have, being an NGO, we don't have any such system, but we are very open, and we'd love to, actually, what can be better than volunteers from an age group which is so close to the below 18 child, being anybody below 18, that they'll understand their mindsets much faster maybe than someone like me who's been here forever. So yeah, we'd love to initiate something like that.
Ma'am, if I may add, during the lockdown and during the semester, we in HDFE, we've got a case profile to do on children in difficult circumstances. And we have gone out and we've tried to interview children below the age of 18 years and get in touch with them and ask them if they have faced any issues, and what help did they get during the COVID from the government. Were there cases of violence that increased during COVID for them? How have they coped up? And listening to you and getting to know about how Childline works is just given us a lot of information that we can reach out to them and we can explain to them about how Childline also works, and we can also put forward and we can help them like in having a better and a safer environment for them. So thank you so much, ma'am. It was a very insightful session for us.
Thank you, Imanshi.
Harleen, I just want to add, the students have done intensive case profiles of children in difficult circumstances. Most of them were child workers, some in dhaba, some in tea stalls or construction sites and all. And they've done intensive case studies and also done surveys, and found out, especially during the COVID, the kind of problems they faced. So maybe in case we come across some child like that, we can put them on to you, and you could help them out.
You have to pick up the phone and dial 1098. There's an email number, dial 1098@childlineindia.org.in. I'd like to add here that the child labor situation is a bit confused because the law now says that if you're in a family practice and if you're above 14 and so on, it shouldn't really apply. We as Childline feel that all children deserve the opportunity to go to school, to lead a life, because if you're out working, there's no guarantee that you are not going to be abused and exploited. It's not there's no child protection policy in workplaces where children are found, in dhabas and in industries like your leather industry and so on. So there is no such thing. So we firmly believe that children should be in school. Schools are not open now. Families are in dire straits. We understand that. but we feel that even for families, even for, in our training with teachers during Nishtha, this was one thing that came up. Teachers themselves in government schools are not convinced about this. They're not convinced that children should be in school. And without apportioning any blame, I think a large part of it is because nobody has ever challenged that thought. Nobody has ever challenged that thought and said कि अगर आपके बच्चे स्कूल जाते हैं और वो सुविधा उनको मिलती है, तो क्यों कोई बच्चा आपके घर में पानी का ग्लास किसी को ऑफर करने के लिए रखा जाए, बर्तन धोने के लिए रखा जाए, क्यों वो बच्चा भी स्कूल नहीं जाएगा? Nobody had ever challenged that thought. So when the thoughts of human beings think in a particular way, sometimes out of habit, if the conversation is initiated, then a lot of them start thinking and saying, oh yeah, I never thought of it that way.
Yeah, and many of these children have never been to school. Some of them have been and dropped out class 7 or class 8. And quite a few of them are migrants, so they are children off the streets, as we say, living on the street, sleeping there, eating there, everything. They have no home.
So, Nirmala ji, it can start at any point of time. There is no, I don't have any ready fix for this situation, but I have seen victims of trafficking, from commercial sexual exploitation, who had not gone to school till the age of 11 or 12. I have seen them in my earlier avatars, not as Childline, but I have seen those girls join schools, go through bridge education, go through open school learning, catch up with everything, and now they are not only, not only have they done graduation, but they are also dance therapists, dance teachers. They've qualified to be dance therapists. So there is nothing which is impossible, provided we give the child that opportunity. The problem is the lack of access to that opportunity, and the the lack of openness in thought that yes, or the resolve that yes, this has to be done. Every single child has to get this opportunity. That is what is missing. Yeah.
Thank you so much for explaining everything in detail, and we will definitely get back to you, and I'm sure some of us will volunteer to work in this area.
We'll be privileged.
I would be happy if some of the students who've been listening on, if you want to ask, because Harleen stays extremely busy. I know that it's very difficult to catch her, and so this is your opportunity, because right now she's captive. So she
happily
can't,
captive.
yeah.
Happily captive.
So that is the reason why I am asking the students to please raise your hand, or anybody, not just the students, anybody in the audience, to raise your hand. And if you have a comment, you have anything to say, I can see Seema has raised her hand. Seema, please go ahead.
Yeah, I just want to share my experience with Childline. When my youngest daughter, last summer, she was just 17 and a half, and she had a lot of time in hand, and she did a little internship with Childline, which was actually a huge eye-opener for her, because she had never seen that side of life. So for her to, go to an office and then be taken to a school, and actually this was a case where 2 children were denied admission to a government school. And she was taken along with an officer to talk to, the principal. So she was sitting outside with the kids while the parents went in with the officer. And they had this big discussion about why they should not, why were they not allowed to, study in that school and stuff. So she was sitting outside playing with these children. And they took pictures, and, she bonded with them, and she gave them biscuits. And so she'd never seen this. So for her, it was huge. And I think I'll be eternally grateful to Childline for that experience.
Thank you so
Thanks,
much.
Harleen.
Thank you.
Hello, ma'am.
Yes, Prerna.
First of all, thank you so much. इतना detailed session था, and it was like a story, and I feel हमारे सारे students को वो जो story way होता है जिसके अंदर हम explain करते हैं, वो ज़्यादा समझ में आता है, and I'm hoping that all of them have understood the session in a very in this manner. And I came to know, like, I didn't know that Childline is working in COVID time as well. So this is something new which I came to know through this session. One question is, were there any challenges in this COVID time? Social distancing tha, and then there were some other things which we have to follow, the government guidelines. So उसके साथ कुछ challenges रहे क्या आपके लिए?
बिल्कुल. In fact, there was a slide on challenges which I quickly skipped because I didn't want to get there. Once I start on those challenges, it takes a long time. So yes, of course, प्रेरणा, बहुत सारे challenges थे. So सबसे पहला challenge ये होता है that mobility. You know, reaching out to the child. Once you get a call, the call center is functioning, the call is landing, and it's being transferred to the local unit. But how do they reach the child when public transport is not working? Childline does not have its own transport system, and a lot of the district administration and machinery were also working with very reduced human resources. So it was the police and it was Childline. So there were a lot of times. Also, if you remember the initial period, even to cross one district and another, or to cross one area and another in Delhi, you required a pass. So to get those passes was not an easy job. To negotiate with other stakeholders so that Childline reaches the child was not an easy job. We were dealing with another challenge was reduced human resource. So we were dealing with much less people to receive the call, much less people who could go out. People kept falling sick. So to give you an example, Prerna, in a contact center in TCS complex, there were for almost first 3 months, I think 3.5 months, there was not a single person except the Childline team, because everybody else had the facility of work from home, but the Childline team was going to receive the call in the contact center. And so if even one person fell ill, or if one person's family members fell ill, the entire operation had to be stopped for 72 hours at least, and everyone put on watch. So these were things which we struggled with during this COVID time. We are not resource rich organization, and most of the resources are for services and not for the back end support. So technology, so that we could work from home, calls being transferred to the house and so on, those are things which we have been working on. It's still work in progress, and hopefully by the time we get through this journey, we will have those things in place so that things are seamless better next time. But we've had that challenge. So mobility, reduced human resources has been a challenge. We didn't have PPE gear. The challenge was getting calls from children who were sick as well. You didn't know whether they were COVID positive or not when you went to respond. You didn't know whether the family was affected or not when you went to respond. So they were working with masks until UNICEF gave us sanitizers, masks for our entire team across the country. We didn't have those resources either. So we were making do. Childline बहुत जुगाड़ करता है, continuously जुगाड़ करता है. It's a typical, if you use Delhi bhasha, it's a street organization which is continuously doing जुगाड़, and the spirit of the organization, the energy with which they work is also part of that जुगाड़. कि हाँ भाई करना है, that kind of a thing. So कर रहे थे, but बीमार पड़ रहे थे. So that was another challenge. Getting recognized, that we need those things, that is still work in progress. Insurance for Childline, being called an essential service, those are things we're still working on. It hasn't happened. Yeah. So hopefully at some point of time, everybody will understand that, just like any other health worker, if a protection practitioner is out on the streets to help a child, they also need to get the same kind of recognition. And if not anything, it's for the morale of the person who's out there, to make them feel good. But care, never mind. When it happens, it happens. Till then, Childline अपने ही पीठ में थपकी देता रहता है और कहता है हाँ हम बहुत अच्छा कर रहे हैं, हम करते रहेंगे. That kind of a spirit. So these were some of the challenges we had.
Wonderful initiative you're involved in, Harleen. Really
Thank
nice.
you so much. Thank you so much.
I think it's a very justifiable peach pe thapki. Harleen. It is a difficult time and you've still managed to keep going. And I think to keep one's spirits up, to look for that ray of light, as you put it, it's not easy. And we need, organizations like Childline Foundation India to keep our spirits up. So thanks a lot. You know, Prerna, you spoke about the way it was like a story, and it was so interesting. That has got something also to do with what is not included in the CV that was read out by Nirmala, is that Harleen is a fantastic debater and a fantastic theatre person herself. So I'm privy to that. So perhaps that lends some, additional color to the way in which she narrates what she feels so deeply about. And I have observed that people who are very passionate and feel very deeply about something, the language flows. And that is what has happened even with Harleen. So from my side, at least, Nimi, before you give the formal vote of thanks, thanks a lot, Harleen. I really have enjoyed listening with this audience to you. Thank you.
Thank you so much.
Thank you so much, Harleen, for accepting to come and addressing us and making us understand all the challenges with which Childline works. And I hope we can contribute in some way. HDFE department students do a lot of internships. So if we could in any way, contribute, we would be very happy to do so. And we look forward to collaborating with your organization in the future too. And thanks for a wonderful session. I see lovely comments in the chat box. We'll share with you. And thank you, Dr. Pal. Without you, we probably would not have done this session. And Dr. Pal initiated a conversation with me saying that I have a dear friend, who's doing fantastic work in Childline. Nimi, would you like to do this session? And I just jumped and wrote a mail to her saying, please do it. We would love to go ahead. And all thanks to you, Dr. Pal, for this session. We owe it completely to you. And thank you so much for being here with us today. And thank you, participants from outside JDMC and JDMC, faculty, students, friends, for having joined us. And we look forward to meeting you again on a different forum. Thank you, Harleen, once again. Heartfelt thanks.
Thank you. Namaste,
Thank you.
everybody.
Namaste.
Stay safe, everyone. Thank you so much.